having some difficulties. Sorry. All right. Bye. Okay, so my name is Kalisha Roy, and I'm gonna be doing healthcare in Honduras. Access to healthcare for families in Honduras is determined by the poverty level, social, economic status, or whatever, and wherever or not they live in a rural area or rural environment. Poverty is a major issue in Honduras, where over 66% of the population lives in poverty line. Poverty, with 1 in 5 people live in extreme poverty. In rural areas, healthcare is much harder to access despite the efforts to improve these conditions. The Ministry of the Healthcare in Honduras provides care to almost 90% of the population, but these services are mainly available in like the bigger cities and making it hard for rural population to service care, which means in Honduras they have churches go to Honduras and they have mission work and they go do care. One of my orthodontist that I go to now, his parents are physicians that work in Africa that provide care to patients over there that cannot get care, and it's the same situation here where people go over there to Honduras and provide care to people that are unable to get care, but at the same time, if you live in a certain area, they're unable to get to you because of your environment, because they have to make sure they're safe at the same time. One of the major barriers, okay, I'm not gonna read it all, but just to gist it up, one of the major barriers receiving healthcare in Honduras is, one of the main problems is the lack of physicians. They don't have a lot of people to go over there and serve. Out of the 1,000 people that's in Honduras, only like that's 30 doctors per 1,000 people that doctors go over there and provide care to, and that's a very low number. Although Honduras is efficient and they definitely have, like it says, a high vaccine rate for kids, which is a good thing. So that means that they're getting the vaccine, so they might not get the chicken pox or something like that. Like that our kids get here, they get the hepatitis and the flu vaccine and stuff like that. So 88, 93% is a very good high number on what those kids are receiving over there. This is just a chart of Honduras. The private, the public, and another sector. If you have a private, a public, and then this would be a semi-private, where what we go here just showing that there's 3 different sectors, and the semi-private is where you might meet poverty, but you don't meet poverty. It just all depends on where you live at. That might be your rural areas where you at on the line. It just shows that they provide this, and this on each one of them. They have the public ones are people that work and can get insurance through their employer and stuff like that. The health, same thing, that they can get help from the state or the government to help them have insurance. Honduras health systems is made up of a private and a public sector, just like the chart just showed you. The public sector is a ministry of health, like the mission work that doctors go to and help out over there. They have the Social Security that which is like money that comes out your check that they get over there and goes to provide vaccines for the kids, or just simple high blood pressure checks or stuff like that. Okay. Like this is, unfortunately, the healthcare system experienced a crisis due to poor management, weak government leadership, poor human resources administration. This has led to bad coordination between the different institutions providing health, and that has only made it gain access to the healthcare harder. A shock of 9 out of 10 people are not covered by health insurance. At least 18% of the population can't get access to health insurance, which it means like, hey, their employer can offer them insurance, but they can't afford the insurance because it's too much out their check. Insurance is extremely high. I mean, think about how much you pay for insurance each month for you yourself, and don't add like a whole family. which is sometimes tricky because some people get a bigger discount. If I have one child, I still have to be considered a family, which somebody that has 10 kids can get that same price for 10 kids versus just me and somebody else. It's a big money racket, and it just shows that not all of them can have insurance. 18% of them can't even get insurance because they don't work or they don't qualify by the government to get that assistance. So that would be if they could get that mission work that people cover that would benefit from that. This is just a picture of one of the hospitals that is up in Honduras. I mean, doesn't look very clean. They're doing the best they can. The infection rate is kind of high due to them not having that cleanliness. Like I know I used to work at a hospital. They used to go through all these steps to clean the materials that they use, and they had scrub nurses that make sure the doctor's hands were clean and stuff like that. They don't have all the resources for things like that, but they do try to provide the best care they can for them. As a result of challenges mentioned above, Honduras has implemented different national health models in 2015. This is a model will provide services to in province, the rural areas, and use preventative care to provide health. Care is improved in some ways, but the use of them model has been sporadic and not consistent enough to have a big enough impact. However, there is good news that this means that hey, they're trying to come up with new ideas. They're trying to get more people involved to come to Honduras to make sure that they can get healthcare to everybody. They're not trying to just leave out the rural areas. Just because you live in a certain environment doesn't mean that you can't get healthcare. It just means that hey, we need to try harder to get to those people and get them some healthcare so that everybody can be as healthy as possible to get that goal of that life expectancy so that everybody can live longer and be around for grandkids and stuff like that. Okay, so that's a long one to read, but the Millennium Challenge Corporation, which is the MCC, has started at 15.6 million threshold for Honduras. That means they're trying to improve the government and improve the health insurance on there. And that this is a program that includes social audits of the healthcare clinics and rural areas and nonprofit and grassroots organizations in Honduras. These are audits that show whether that clinics are not providing adequate care to the communities, that then the results are delivered to the healthcare center, the manager who come up with new plans to fix these problems. Real changes has been seen in the result of the audits, and the clinic starts to make more transparent about what they have offered and improve doctor-patients relationship. This has allowed more and more success and consistent implementation of the new healthcare model have been rural communities, which means, just like I said, that money that they're getting from the MCC Corporation, they're giving that money to help make it better. That while they're running these audits, they're saying, hey, like the picture of them in surgery is showing them that, hey, this is not a clean environment to be having performing surgery on. Like, hey, what's the person that's on that table going to catch MRSA after they get off the table because of they don't have that proper sterilization that they can use like we do here in America or the United States. They don't have that scrub nurse to help them clean their hands. This is the audit to show like, hey, if we do this sterilization station or bring in nurses or try to bring nurses in to help scrub in and clean those scalpels and stuff again, that hey, if we do spend the money on that, then hey, we're going to lower the infection rate over there. They are coming out with new plans every day. If they try to get more kids out, that the vaccine that they won't be showing more kids with the flu or more kids with the chicken pox or more kids with the measles or anything like that, ear infections, anything that when they do these audits, they're showing, hey, if we get this penicillin over there or if we get certain medicines over there, they show that, hey, we're helping out. Some of that money can be used to help them get to the more rural areas over there that they can't get to encourage people, the mission workers or doctors, that hey, this is getting better. You can make that difference, and just by going over there and helping them. This is just a picture of a hospital in Honduras of them waiting just to be seen or get picked up to go back home or whatever like that. They're trying to improve every day, but hey, you can't make change overnight. All right.